Chicago-based researchers tracked the number of people 65 and older living with Alzheimer's across the country. New York State ranks second overall for highest prevalence of the disease.
In their study, experts say this information should have a very high impact on health programs aimed at prevention, detection, and treatment.
This is a disease that has touched so many families, and it's really hard to understand its impact just in numbers. So that's why tonight we are taking some extra time to bring you the words of a Western New York man living with the disease, a neurologist optimistic about treatment options, and our local chapter of the Alzheimer's Association talking about how they plan to use this new data.
Yeah, the organization says this study gives them a clear picture of the disease here at home.
7 News I-Team producer Sean Mickey is breaking down the numbers where you live.
This new study marks the first time researchers have estimated the prevalence of Alzheimer's at the county level, rather than estimating statewide numbers. I spent the day poring over this data to give you a local breakdown. The dark purple counties, Erie and Genesee, are where researchers found the disease is most prevalent here in western New York. Wyoming County has the lowest percentage of Alzheimer's dementia in our region. The Alzheimer's Association of Western New York says this information will help guide their support.
Having this data is really helpful because now we know where to kind of direct our resources.
And our local chapter already analyzing this data.
This is something that we've kind of been speaking in generalities for years, saying, well, there's about 400,000 people in New York State that have a diagnosis of Alzheimer's disease, but we could never give people any more kind of granular information.
I had to spread the word. I had to get rid of that stigma that's out there. Let people know it's okay to talk about it, because if you don't talk about it, it's not going to make your situation better.
David Gonlag is living with Alzheimer's disease. He's one patient of thousands who could benefit from additional resources.
There was a time when people just didn't talk about dementia and Alzheimer's. It was sort of at the stage where cancer was, and cancer used to be the big C, and nobody would talk about it. And Alzheimer's had that same stigma associated with it.
The study also points to implications this could have for treatment. Researchers say their findings could possibly expand Medicare coverage for Alzheimer's drugs in heavily impacted areas. This comes weeks after the FDA approved the first treatment for the disease in decades, which has doctors in Western New York optimistic for the future.
And now it's a total game changer. So now people will want to know. People need to know as soon as possible, because that's when these medications can work for them.
For 7 News, I'm Sean Mickey.